ENN's 64th issue of Field Exchange was published in January 2021. This is a general issue of around 100 pages with a wide range of content drawn from multiple organisations and countries with 2 themed sections. This presentation aims to provide an overview of this content. This issue includes a special section on CMM Surge. We worked closely with Concern Worldwide to produce 7 articles, one that sets the scene, another on experiences in Kenya, another on West and Central Africa scale-up experiences, another on cost effectiveness, one on the concept of health surge, and an article on lessons learned and another on the way forward. What is CMM Surge? It's a health system strengthening approach that enables the surging of CMM programme capacity in response to spikes in wasting caseloads at local level. We know that wasting caseloads rise and fall over time in line with seasonal variations and external pressures. CMM Surge aims to increase the responsiveness of CMM to this, using local knowledge to trigger early action when spikes occur. CMM Surge has been spearheaded by Concern Worldwide as one of a number of approaches being trialled to strengthen CMM and increase coverage of services. It was first piloted in 2012 by Concern in the context of the CMM programme in the Kenya arid and semi-arid land region, an area very prone to drought. It's since been scaled up in 12 countries, 7 of which are supported by Concern and also now a global technical working group. The concept is also increasingly being applied to other childhood diseases, known as health surge. CMM Surge focuses primarily at health facility level. The approach is intended to build the capacity of health facility staff to understand patterns in wasting levels within their catchment areas, drivers of these patterns, and then how to read them so that early action can be triggered when they rise to certain levels. The first figure here describes the steps that are taken to set up and manage CMM Surge at health facility level. The second figure, on the right, shows what this might look like in reality in a health facility. This example is taken from a health facility in Kenya. You can see at the top the result of a trend in situation analysis. The middle right shows thresholds set for severe acute malnutrition and moderate acute malnutrition within this facility. On the left, actual levels are presented, plotted, which show clear peaks in SAM and MAM caseloads in September, and the bottom shows actions that the health facility have taken in response within different months. On this slide, you can see a picture of a district-level dashboard. Health facility data can be fed to district level where thresholds, caseloads, and levels of surge are recorded. And this then provides an online dashboard to give real-time data to aid in decision-making. The right-hand maps show where CMM Surge has been scaled up so far, and the bottom shows which of these countries health surge is being scaled up in. The Lessons Learned article in this special section provides rich learning across the different country and regional examples. For example, strengths of the approach are that it's relevant and acceptable to health staff, it leads to improved understanding of wasting spikes and causes, it leads to increased responsiveness of the health system, and it has broader applicability beyond wasting to other common childhood diseases. There are also areas that need to be strengthened in the approach. For example, monitoring of the use of data at higher levels, such as district and national levels, the systematic involvement of community stakeholders, and also more frequent review and revision of surge thresholds. There are still many questions that need to be answered going forward around the CMM Surge approach. For example, what's the potential of health surge? Who should be involved? And where should the health surge approach be located so that it can be moved forward? Also, how should CMM's contribution to health system strengthening and resilience be captured? And how is the approach used in fragile contexts? And finally, how can CMM Surge data be embedded within early warning systems? We really encourage you to get stuck into that special section to learn more. The second special section in this issue of Field Exchange is around programme adaptations in the COVID-19 context. We include 4 different field articles that describe programme adaptations in different contexts. The first article is by Action Against Hunger that describes adaptations made in 40 different countries. These adaptations include the use of family MUAC, that's home-based screening using mid-upper arm circumference tapes, changes in the frequency and method of follow-up, and modified admissions and discharge criteria. The second article in this section is by UNICEF in Zimbabwe, and this is all about the use of Rapid Pro software that allowed remote nutrition data collection submitted via mobile phone for central analysis to inform decision-making. We have another article by World Vision that describes programmatic adaptations made in their Zambia nutrition programming. This included the provision of PPE, adjusting protocols including reduced frequency of follow-up and strengthening the supply chain. All of this enabled wasting services to continue in the COVID context. And we also have an article by Goal that describes the use of family MUAC for infants under 6 months in their Gambella programme. In this context, home-based screening by caregivers using adapted MUAC tapes was implemented with training by community health workers. In this context, referrals increased and measurements showed great accuracy, and they're now exploring scale-up of this approach. We also include 3 other field articles in this issue of Field Exchange. The first one is about the transitioning of nutrition programming in Kenya from humanitarian aid to government-led, managed and financed nutrition programming, all through a health system strengthening approach. This one is well worth a read. We also include a very interesting article around the integration of family planning and nutrition programming. Experience here shared from the Suahara 2 programme in Nepal. And finally, we include an evaluation of the humanitarian nutrition response in northeast Nigeria. This evaluation of the rapidly scaled up nutrition response between December 2018 to March 2019 has really important lessons learned and is well worth a read. 2 very interesting research articles are also included in this issue. One provides operational insights from the RISE study. The RISE study developed and tested simplified treatment protocols, tools and job aids for literate and low literate community health workers to deliver wasting treatment through integrated community case management platforms. The second research article is around the use of satellite imagery in conflict affected areas in Mali to support WFP's emergency response. Finally, as usual, you'll find in this issue of Field Exchange a large range of research snapshots, 29 in total. These provide very short summaries of published peer-reviewed articles that we think our readers will find interesting. We also include several research summaries from different authors and also summaries of important reports, as well as news. Across all of this content, there are several themes that we've really brought out in our editorial. First of all, health system strengthening. Of course, we have the CMM Surge example of this. Also, the importance of government leadership really comes out strongly in the Kenya article. We also have another theme around the need for flexible financing, the need for cost and cost effectiveness analysis around health system strengthening, and also questions around what should happen in fragile contexts. Of course, we also have another theme across this issue around COVID innovations. Across many of the articles, we see an initial fall in service uptake after the pandemic hit, which then gave way to increased service uptake due to the innovations and adaptations that took place. Of course, there should be caution in interpretation of all of this, particularly around the use of MUAC-only programming. Much more analysis and research needs to be done in due course. Another theme that comes out in this issue is the power of information. The articles from the CMM Surge section show that health facility staff are able to use their own information to make decisions as a result of this approach. Also, the Kenya article shows that the National Nutrition Information System was really key to health system strengthening in that context. We also have two examples of how technology can be used to enable information to impact nutrition programming. First of all, through the Rapid Pro Zimbabwe example, and secondly, through WFP Mali's use of Earth observation data. Another theme is task shifting to community health workers. Community health workers have been front line in the COVID-19 response and are a really important route to scaling up nutrition programming. But training and supervision is key, and incentives and motivations also need consideration. One of our snapshots that we include is around a paper on sex differences. This summarises a systematic review and meta-analysis of 44 studies that show consistently higher odds for boys being wasted, stunted or underweight than girls across multiple contexts. Possible reasons for this are being examined, but this could have a big impact on how sex differences in programme admissions are regarded in future. Adolescent nutrition. We highlight this in this issue as it's an area that's gaining increasing attention. We summarise the results of a stakeholder survey on this topic by ENN, plus several research articles focusing on this age group. We'll be running a special issue on adolescent nutrition and field exchange later on in 2021, so watch this space. And finally, we highlight a couple of articles in this edition that prompt us to think about how we create space and platforms for members of the nutrition community from national and sub-national levels to engage in global discourse. We highlight the Silent Voices Bukavu Expo that explores power dynamics between researchers from Global North and Global South. And we also include a letter from Barek Apera, a nutrition lecturer and researcher from Ethiopia, that reflects on the value of national researchers engaging in international conferences.
Hello everyone, my name is Nikki Connell and I have just joined the Emergency Nutrition Network as co-editor of Field Exchange. I thought a good way to introduce myself would be to share some reflections on Field Exchange 64, and so I have written a blog which you can find on ENN's Media Hub webpage. One key theme that I picked up on in this edition was around government ownership of and leadership around nutrition service provision. There's examples shared from Kenya and also in relation to the CMM Surge subsection. One element that we need to ensure we're measuring is cost effectiveness when it comes to government ownership, because government decision making also revolves around financial resources, and with depleting resources available, it's important that we're measuring cost effectiveness of our nutrition interventions to support government decision making on how to prioritise those limited resources. I think another thing we need to do better on is simplifying our messaging in the nutrition sector. Less is definitely more. This doesn't mean dumbing down nutrition content, but rather better marketing for nutrition in lots of ways. I think the letter from Mubarak in Ethiopia, someone I've worked with closely in the past, really highlights a key issue as well that we're grappling with in the nutrition sector, and that's on voices from the Global South and adequate representation of voices from the Global South in conferences and other fora. I think we all need to take stock of what we can do to support this effort, because after all, that's why we're here, is to support the Global South, and their insights are incredibly valuable. Just to flag that our next edition of Field Exchange is coming out towards the end of this year, and that's going to be on adolescents and children aged 5 to 9. We will be releasing a call for content soon, and we do really encourage submission of content related to adolescents and the age group 5 to 9. And also, of course, if you've got other content that is not related to adolescents, please do also reach out to us, because we will have future editions of Field Exchange coming out in 2022 and onwards, where we can feature other content. I think moving forward, we want to address how we reach people with Field Exchange, and also to make sure that we're reaching them with the most useful content. So any ideas you have on how we can improve Field Exchange, I would also be very keen to hear from you. We look forward to working with you in the future on content for Field Exchange and recording your experiences from the field. Thank you.
All of the articles from issue 64 are now available individually and as a PDF on the Field Exchange pages of ENN's website. We are developing podcasts currently with key authors that will go up in the coming weeks on our Media Hub pages. And right now you can find the blog written by Nikki on our website on the Media Hub page as well. Thank you to the Field Exchange team and all of the individuals at ENN who support the publication, and of course to our donors. As ever, we look forward to hearing from you, our readers, and receiving your ideas for future articles. Please email us at chloe@ennonline.net.